back to my channel, Doctor in Style, and I'm going to be talking to you about different topic today. We've got medical segment and I'm going to be talking to you about coronavirus. Everybody has heard about coronavirus and coronavirus pandemic, and we all know that coronavirus not just affects respiratory system but also affects almost all organs in our body, and it can affect central nervous system as well. It can affect skin. But I want to tell you from my experience as a doctor in the hospital, it's completely different, a whole new experience. We all have seen COVID pandemic, and I must say, although people are saying that it's on decline, I am still seeing patients with coronavirus in my daily practice. And about 20 to 30% of these patients develop clotting problems. We know that COVID or coronavirus affects respiratory cells. So respiratory cells are called in biology, they are called alveolar cells. They are lining small alveoli. Alveoli then become small bronchioles and they become bronchi, and then bronchi joined into the main windpipe, which is in the middle of our chest, called trachea. Let me first show you some scans of, for example, how the normal lung looks like. So you can see the black areas is a normal lung and the white areas is contrast in the arteries. And what we want the black areas, which is lung, to be without any white areas. And when you get virus, you get the three types of infection, which you see radiologically, means on the pictures. You can get mild, moderate or severe. And this is depicted by the X-rays and the CT scans. So, for example, in mild, you can see there are these peripheral shadows in the lungs, which are the black fields. And you can see they are very subtle. We call it ground glass changes. The next stage is moderate. So in this picture you can see the areas become more solidified, we call it more confluent, and there is more white within the lungs and they become stuck to each other, and we call them consolidations. You can see the most of them are sort of on the edge of the lungs, we call it in the periphery. The appearances of moderate COVID are similar to any other bronchopneumonia which we can get from other bacteria, viruses or fungi. And similar appearances you can see on chest x-ray. Sometimes even a chest x-ray is clear and patient might have COVID and you don't see anything. In other instances, patients might be really sick and you can see only subtle changes, for example, like evidenced on this chest x-ray and on this CT, that the patient is very ill, but you can see the white areas, which are the infections, are only very sparse. We all know that COVID attacks small cells within the alveoli in our lungs, and this causes white appearances. So if infection progresses, the white areas, so-called consolidations, become more dense and dense. And this means that you are struggling in terms of your breathing and you are unable to exchange oxygen in the small airways. So what actually happens when the virus attacks your lungs? So it goes into the small airways and it attacks alveoli. It penetrates into the cell via the receptor, and this changes the cell's DNA and causes the cell to have less of a particular receptor. What happens? This results in three things. In number one, it causes vasospasm or vasoconstriction. It means that the vessels become more tight, so less and less blood gets into the lungs, and we need blood to get oxygen, because this is carried into your heart and into the rest of the body. So less and less blood gets into the lungs. Because it changes this receptor on the cells, it causes infection or inflammation. That's why we see these white appearances on the chest x-ray, because the white appearances are due to exudate, so-called fluid from the infection. The third thing virus causes is tiny blockages, because when the vessels are already narrow, the blood flow is so slow, and also inflammation induces so-called cytokine storm. Cytokine storm is on molecular level. This inflammation and cytokine storm is happening in the endothelial cells. These are the cells which are lining bronchi, and it leads to formation of clots. And this again causes cascade of more and more production of these inflammatory substances, and everything is just getting worse, and this is a vicious cycle. So that's why patients are getting more and more sick when they are attacked by this virus. And the white exudative process, what we were talking, is accumulating in the small alveoli. This is resulting in blockage of the alveoli because they cannot exchange oxygen for carbon dioxide, and this causes respiratory failure. And the white stuff which we see is also part of something called ARDS, which is acute respiratory distress syndrome, which is basically respiratory failure. So less oxygen reaches bloodstream, and these have severe repercussions on our body. Recent report in Lancet, which is a renowned medical journal, suggests that there are two types of phenotype of COVID, which causes two types of ARDS, acute respiratory distress syndrome. One is called L and one is called H. The H type ARDS refers to the lung elastance, which means that the lung is very stiff and there is a poor respiratory function. The H-type ARDS refers to the lung elastance, which means that the lung is very stiff and there is a poor respiratory function. The other type is L, which means low elastance. So in H-type the lung looks like this, and in the L-type the lung looks like this. So you can see the white areas in the L phenotype or L-type of ARDS do not have as much as white stuff in their lungs, given the severity of their hypoxia. There must be something else in these patients which is contributing to their very poor presentation and very poor respiratory function. It is speculated that there could be a high pressure in the arteries and there could be a spasm leading to microthrombi. These tiny blood clots can progress and get bigger and bigger and eventually block bigger arteries and cause what we call pulmonary hypertension, which is raised pressure, and this can lead to dysfunction of the heart, and also the blockage of main pulmonary vessels can lead to pulmonary infarcts and sudden death. On the other hand, there are also some speculations between the researchers whether these subtypes just represent the same spectrum of known conditions. So, for example, that the subtype L is just less severe form, or it's just progression into the subtype H. The coronavirus has been shown to cause development of small microthrombi in the vessels which travel into the lung, and from there they can cause obstruction of the blood flow in the lung, and this can cause pulmonary embolism. So let's all of us take a look how does the blood clots look on the scan. So here is a scan. So this is CT pulmonary angiogram. What we are looking at is these two arteries, which are the pulmonary arteries. And this is the ascending aorta, aortic arch, and then we've got ascending aorta. You can see these are not as bright as the pulmonary artery, and when we follow the pulmonary artery branches, you can see that in the lower lobe branches, just here, did you see there is a filling defect? Can you see this dark? So it's not as bright. And then you can see it on the other side as well. Look at this. So these are pulmonary emboli. And generally we see a very large number of patients with COVID and prothrombotic status. It can be between 15 to 20% of patients present with some sort of blood clot in our practice. Recently published research on COVID-19 shows that it can cause severe inflammation throughout the body, which increase the risk of a fatty plaque in the vessels, and this may lead to rupture of the vessels or blockage of the vessels, and in the end this can lead to stroke, and this can happen in any patient regardless the age. We see in patients as young as 20-30-year-olds who experience stroke, and they only have very mild symptoms of COVID. So what are the symptoms to watch out if you have COVID and you are worried about if you might have a stroke? So the main symptoms, as we know, is weakness and paralysis of one side of the body or face. The other signs may be decreased sensation in parts of the body, especially in your extremities, and also speech or cognitive impairment. And on this scan you can see is a CT head. So we are looking for this dark area, which means this is an infarct caused by pulmonary emboli or by emboli thrown into the carotid vessels, which then travel into the brain arteries and block off small brain arterioles, and this leads to less supply to the brain parenchyma and eventually brain infarction. Sometimes what we do, we also perform so-called cerebral angio or angiogram of circle of Willis, and this can visualize filling defects and thrombi. And as we discussed, the blood clots you get not only in COVID, but also you can get it in other serious illnesses if you have septicemia, if you are not mobile, if you had surgery, but also from travel if you are sitting around a lot, or if you have any other underlying disease which causes problems with clotting, for example liver disease which alters your clotting time. So it is now common knowledge that patients with COVID infection and other influenza viruses have very high prevalence of venous thromboembolism. So lastly, you might be asking, how can I prevent formation of DVT or venous thromboembolism? So number one is you have to keep hydrated and you have to keep moving. Any movement is helpful because it can pump the blood back into your heart from your legs. Try to wear loose-fitting clothes. Sometimes you might be prescribed to wear special kind of stockings from your doctor, so these are more compressive type of stockings. Do the exercise that you are recommended to do by your doctor. Change your position often, especially during long-haul flight. Perform feet and ankle exercises. Raise your legs 6 inches above your heart from time to time. This helps with venous return. Do not stand or sit for more than 1 hour at a time. And this is very important, eat less salt. The more salt you eat, you will have more risk of hypertension, blood clots, and also you have increased risk of diabetes. How you know that you eat more salt? You feel always thirsty. Try not to fold your legs or cross your legs too often. Do not use pillows under your knees. Raise the bottom of your bed by 4 to 6 inches. Take all the medications which doctor prescribes you. So guys, this was my short video on COVID. If you like this type of video, drop down the comment below and tell me what's your suggestion for the next video. If you like more this type of medical updates / health videos, or if you would like to see more of me in the skincare / fashion, and I would be here if you have any questions, please ask, and I will see you on the next video. And don't forget to subscribe and hit this bell button so this will notify you when I put up some video. Hope you like the video and I will see you later. Ma salam.